Questions?
Governor, what do you think of the president's suggestion for research into ingesting bleach or using UV rays as COVID treatments?
I don't know much about UV rays. Not my job, not my business, not my education, not my background. Dr. Zucker, what do you know about UV rays?
I think that anything when it comes to bleach, these are chemicals you would not ingest, and as we know, we make sure our kids do not go into cabinets that have any of these chemicals in them, so need to stay away from those products.
Okay. And have you heard anything from the president about how he might exactly help New York with the supply chain issues when it comes to testing and helping manufacturers?
Yes, that's what we've been talking about for the past 2 days, that I had a meeting in the White House, and the president and his team are going to work on the supply chain issue for the national manufacturers to get the reagents, test kits, so they can provide our commercial labs here in New York. And we want to go from a goal of, we're now doing about 20,000 a day, we want to go to 40,000 a day. Karen?
I just want to ask you about the mail-in voting for the June 23rd primary. People on both the left and the right are saying it may not be a good idea because the Board of Elections is not up to carrying out this task. So would polls still be open for people to go to?
Yes. Polls would be open.
And you think the Board of Elections can carry this out? Are there problems?
Well, Karen, life is options. You have an election. There's only 2 options. Either people go to the polls or people vote by absentee. There's no other way to do it, right? We're saying you have both options. You can go to the poll or you can vote absentee. I don't know what else anyone could expect anyone could do.
So are you mailing an absentee application?
Excuse me one second. What is the other option? People on the left and the right are unhappy.
Yeah.
What do they recommend? Right? There are only 2 things. You have an election. You can go to the poll that day, or if you don't want to go to the poll, you vote absentee. We're doing both.
Well, do you worry that there could be some kind of mistakes, or the result won't be valid because something might happen with so many people?
Well, then if you're against absentees, then everybody goes to the polls. Is that what they want? No, they don't want that either, because they don't want people going to the polls, because then you wait online and you come in contact with other people. Right? So life is options. Bernadette?
Oh, yeah, just wondering, so are you sending an absentee application or an actual ballot?
Melissa?
We're sending an absentee application. So Article 2, Section 2 of the Constitution allows for an absentee voting process, and there are 2 provisions, one if you're out of county, the other is a list of specific things that were enumerated in law by the legislature. One of those is temporary illness. The executive order the governor did a couple of weeks ago amended the temporary illness provision to include risk of contracting COVID. So we looked at this very closely. I know some people thought that this should be you send everybody an actual ballot to vote, and we don't think that that's within our constitutional right for the governor's directive powers to override the Constitution and create a mail-in voting system where one otherwise doesn't exist. So what we're saying is everyone's going to get an application with postage, so this is easy. Every registered voter gets one, they can fill it out, they send it back in. And to the question of whether or not the Board of Elections can handle this, the provision the governor did a couple of weeks ago allowed for anyone to already be able to do this. It's just that then you would have had to download the ballot, call to get a ballot, go to the BOE to get the ballot. So all we're doing is making this more convenient so that people who don't have access to internet, don't want to leave their homes because of their fear of COVID, are able to get an application directly sent to them with the return postage to be able to get the absentee ballot that our early executive order allowed for.
How smart is that?
Governor, we're a week away from May 1st. Millions of New Yorkers have rent due, they have mortgages due. Have you given any thought to a rent freeze for renters, or to extend mortgages by that 3 months so that those loans would be extended so that people aren't going to be facing a kind of a large payment when your moratorium is complete?
Yeah, we're looking at that right now. What do we do at the end of this moratorium? We have a number of options we're looking at.
Is rent freeze amongst them?
We're looking at all options.
And then one follow-up question. We're now 3 weeks away from when the on-pause order is supposed to be done, May 15th. Parents are trying to figure out whether or not their kids are going back to school. Can we get a timetable on when you might make that decision?
About 1 week.
About 1 week
so
from
we
today.
give people some notice. Governor,
Governor, no, I was just going to say, on the rent freeze in New York City, that's controlled by the rent board in New York City, and that's entirely controlled by New York City. I know Mayor de Blasio has been calling for them to do the rent freeze, but that's outside of our actual jurisdiction. That's controlled by the city.
Could you conceivably do that in other cities in the state, Utica,
That's
Albany?
something that we're looking at, but the pressure has obviously been in the city, and that's what the conversation has been, and that's something that I know the mayor is focused on.
It's really an issue in New York City, which is where.
When might a decision on that be made, just so people can plan?
Well, the New York City decision, New York City has to make. What we do on our executive orders that are going to expire, we have a couple of weeks still. So we'll give people timely notice, but we're looking at all options.
Has there been a task force, and this is probably a question for Melissa too, since I know you've been spearheading it, but has there been any update there on the safety of pregnant women giving birth during the pandemic, and just how is that working going so far?
We're going to be giving the governor a list of recommendations this weekend for executive action. So you'll be seeing something in the next couple of days, but we've been meeting every day this week.
Governor, that revenue shortfall opens the door for you to institute a cut to local governments, to schools. Do you intend on invoking that power, and what kind of cuts should those entities expect?
We're looking at that now, and we don't have a decision now, but I'll tell you the truth. I said to the federal government, I've been talking about this for how long? 2 months. 2 months. I said, how can you have a federal government in a position where they're not going to provide funding to state governments and local governments? Small business, airlines, business program, now some of these large corporations now apparently have been taking money from the government programs, and they're not funding state and local. When you don't fund state and local, you know who you don't fund? Police, fire, school teachers, school officials. What was the possible theory of funding large corporations, but not firefighters, and not police, and not healthcare workers? I mean, it boggles the mind. And all they said was, don't worry, right? Don't worry, we're going to do it in the next bill. We're going to do it in the next bill. We're going to do it in the next bill. I said to our congressional delegation, I said to our senators, Schumer and Gillibrand, don't pass this past bill that they just did unless you have state and local funding, because they're not going to do it. Don't worry, they're not going to do it. As soon as the Senate acts, McConnell turns around and says, oh, I'm not going to do it. The state should declare bankruptcy. Bail out to the blue states. Bail out to the blue states. Again, the most un-American, uncharitable, ugly statement of all times. Yes, New York had more coronavirus cases than Kentucky. You know why? The flights from Europe land in New York. The flights were not landing in Kentucky. That's why we have the coronavirus cases. That's what the researchers now found 2 months later. That the virus went from China to Europe, got on a plane, and came here. And by the way, the virus probably got on a plane in China and came here. But China maybe landed in California. The European flights landed here. That's why New York has the coronavirus cases. Bail out New York. You're not bailing out New York. New York has bailed you out. Every year, it's bailed you out. Mitch McConnell is a taker, not a giver. New York is a state of givers. We put more money into the federal pot every year. We're the #1 state in donating to the federal pot. #1. Kentucky is the #3 state in taking from the federal pot. They take out more from the federal pot than they put in. Every year, every year. But this is America. States, one federal pot, you put in what you can, and the states that need it, take it. Okay. So for every year, New York was the #1 donor state, putting in more money than it took out. Putting in more money than anyone else. and taking out less. Number one donor state. Kentucky every year was the number 3 state that took out more than they put in. So they were we were putting money into the pot, they were taking our dollars out of the pot. And now he wants to look at New York and say, we're bailing you out? You're bailing us out. Just give me my money back, Senator. Just give me my money back. I mean, it's just ridiculous. States should declare bankruptcy. Okay, Senator, pass the bill that authorizes states to declare bankruptcy. Sign the bill, Mr. President. Economy's coming back. We're doing great. Pent-up demand. Stock market wants to take off. Good. Pass a bill allowing states to be bankrupt. And then let's watch how the stock market takes off at that great news about our economic resilience.
Senator, I have some questions
Yourself?
on antibodies.
Nursing home operators have said that they're facing staff shortages, people are getting sick, and they have to take the staff out of rotation. Of all of the healthcare volunteers that the state has collected into this portal, have any of them been sent to nursing homes?
They all have been sent. The portal has been made 100% available to all nursing homes.
So you have to request, the nursing home has to request?
No, you get a list. Nursing home goes online. Here's the whole list. Go to the list. Here are 60,000 people. Hire whoever you want. They all said that they're available and they want to help.
Thank you. First of all, I actually wanted to tell you something. I've been speaking with reporters from other states, and one from Arizona told me last night that the state officials there are not giving any information on COVID-19, so I wanted to say thank you for taking our questions.
Oh, thank you very much. Thank you from a reporter.
VP Pence said
Surprises never cease. There is the positive of this coronavirus. Reporter says thank you. Have you ever heard of that?
VP Pence said 16 states have submitted their reopening plans. We haven't heard the entire list of states. I wanted to know, are we on the list? And in terms of reopening, is the plan anywhere near being done for New York?
We're not on the list. If you look at the 16 states, those tend to be the states that had a lower infection rate, lower hospitalization rate, lower death rate. We're not in the first 16 in terms of just on the numbers, on the data. Also, our plan, we'll have a statewide plan, which will basically be focused on lessons learned, but then we're also doing a regional analysis, because in this state, some of the states are basically homogeneous. New York is anything but homogeneous. We have the most dense urban area in New York City, and then we have rural areas that could be in Ohio or could be in Montana. I mean, you know, we have areas where you have very few people, basically agricultural. So we have both, and that's why we're saying we'll do a regional analysis depending on the numbers. Some regions could open up before others, as long as the way we open up those regions don't cause unintended consequences where they wind up with different problems because everybody now comes to drive in to go to their beaches or their parks or their businesses, et cetera. You know, you open up Main Street now anywhere in the state of New York, you'll see people in their cars driving up from New York City to go to that Main Street. I have no doubt. You see these pictures of beaches opening up. People will drive hours to go to a beach right now, right? You want to get out of the house, you have the kids who are making you a little crazy, put them in the car, drive 4 hours to go to a beach. People would do that. I told you I saw a couple right here in the corner, drove up from Queens to buy Thai food in styrofoam containers and sit in the car and eat it. I said, why don't you just buy Thai food in Queens? They said we needed to take a ride. I mean, that's, you know, look at that pent-up concern.
So following up to that, in terms of coming up with our reopening plan, do you know when our plan will be complete, or are we just still, do we still have too much of an issue here to even get to that point?
Well, the CDC guidance says before any state should open, you need 2 weeks of flat or declining numbers, right? So by the Fed's CDC guidance, we're not there yet, right? The 2 weeks is flat or declining. So even by a region, we'd have to do 2 weeks of flat or declining. Declining is obviously better than flat. So if you're just complying with the federal guidelines, you need that 2 weeks of case data.
In terms of, one more, sorry. In terms of antibody testing, so our viewers are so interested in antibody testing. Yesterday, when you gave the numbers, I was curious, do you know how many tests that you need to do for antibody testing before you'll feel comfortable?
You could consume double the capacity of all the labs in the state of New York to do testing, and you would not have done enough. You can never, you'll always want more testing. You can never do enough testing in the nursing homes, in the prisons, in long-term care facilities, population at large. You could never do enough testing.
Do you have a goal, though? Because that's kind of a broad...
Do you guys have a specific goal?
We're going to be in the field for the next several weeks. We actually are in 15 locations downstate today. We're going to be in other locations on Saturday, Sunday, so this is going to be an ongoing thing. And as the governor said yesterday, as these results come in, yesterday was preliminary, we'll keep reporting those results out.
Let's take one more. Go ahead. Someone who hasn't asked a question?
Governor, the numbers you released yesterday essentially established a statistical baseline. I'm wondering if it would be reasonable or feasible or useful to mandate testing of patients and staff in nursing homes. Would that be helpful?
It would be helpful, but you have to have the capacity for them to do that. They are now testing. I don't know how many are testing. Maybe the Dr. Zucker does, but yeah, we have testing in nursing homes. We're doing a lot of testing in nursing homes. We're checking the temperature of every staff member that comes in. We're not in a position to say we can provide enough tests to do every staff member every day. But do you know any of the numbers?
I couldn't give you the exact numbers, but as the governor said, it's a comprehensive plan of both screening, testing, evaluating what else concerns of infection and spread. So we're working on that, and we're looking at the possibility of how we can, as the governor mentioned, test staff as well as individuals who live there.
Testing in nursing homes? Is the testing in nursing homes?
Go ahead.
Are people who are participating in these tests being informed of their results? And then relatedly, Commissioner Zucker, you said that you have a high confidence in the reliability of these tests. Can you explain why you believe that these are accurate when there are so many questions about their reliability?
Go ahead. Because it's his test. That's why he believes in it. This is not somebody else's test. This is a test he developed. Go ahead.
My confidence is in our Wadsworth lab test, as the governor said, which has an unbelievable sensitivity and specificity. For those who are getting tested, they want the results. We provide them with their results and an information sheet about what those results mean.
The antibody tests you're talking about are commercial antibody tests that are available. This antibody test was developed specifically by the New York State Department of Health. It's our own test. Let's take one more. Go ahead, Nick.
Governor, should local health departments have access to the health emergency response data system? This is something that the Dutchess County executive is seeking.
Do you know what that is? Say it again.
It's the health emergency response data system.
Well, we receive the data about all this information. If the county health departments want to know, we're happy to share that information with them.
Thank you, Dennis, if you're watching. Thank you very much, Northeast Kansas.
When does the state anticipate adding, say, thousands of probable deaths that New York City has been adding?
As soon as we get probable is what the Times added to actual deaths, to be a little misleading, frankly. Because probable is probable, but it's not actual. But as soon as we get the at-home deaths, we will add them to the actual deaths. But probable is not actual, right?
When do you anticipate that happening?
As soon as we get them.
That would be central to any calculation.
Yeah, but we don't do them. As soon as we get them, we'll add them.
That total for 2 weeks now, so the state's a little behind that.
Well, we have it for the city, but it depends on how the locals report.
Right. What's the lag? What's the holdup right now?
Well, we have to get it from the local government.
So it's coming from local government and what, local health departments?
We don't do the actual the morticians, whatever the coroner's reports are, they are handled locally and given to the state. When we get them, we release them. Thank you, guys.
Providing essential